First thing we're going to talk about is anesthesia and making sure we get Brad good and numb with the least amount. When we're doing this much dentistry, we don't want to overload with anesthetic and too much anesthetic. So what we're going to do is we're going to gradually kind of numb him, and then we'll, about halfway through, we'll numb some more. But the technique that we're going to do today is, one, we're going to, he'll be on nitrous, so that's number one, getting him good and relaxed. Then we're going to get the soft tissue really good and dry. We're going to use topical anesthetic. We're going to give it time to work. Then we're going to start with warm Sitinist, and we use a very plain anesthetic, that warm Sitinist. We warm it up because the body's warm, 98.6, and we want that carpule to be close to that, so when it goes in, it's not a different temperature change. So we'll start with a little Sitinist. When we're doing the upper 10, what we're going to do is we're going to split 12 and 13. We're going to numb 11. We're going to split 9 and 10. And so when we follow the Sitinist, we're going to come with a buffered septicane. And I'll show you the technique here in just a second. But the main thing we're going to do is we're not going to put the needle into Brad's tissue. We're going to take his tissue and pull it over the needle. And I'll show you that technique. And then the other thing is we're going to go very, very slow. Even slower than you're thinking. So other than that, let's get rolling. Right, as we're going to do, we're going to get this good and dry. Always the first step, put a little piece of dry cotton roll in here, get this tissue super dry. Topical on that left side. There you go, give you that and that. Keep it there with some dry cotton rolls. I do the same thing on the other side. And we're going to just place a little top of this little jelly here and help that tissue get good and numb. I'll put a little piece of cotton in here to keep it there. One of the key things we're going to do with anesthesia is I'm not going to insert that into the tissue. I'm going to grab with these two fingers, I'm going to take this tissue and I'm going to pull it back towards his eye. And I'm going to split between 12 and 13. And I'm just going to pull that tissue over. And while I'm pulling, I'm just inserting a little bit of anesthetic. I'm also shaking with the amount of pressure that I'm using. Is probably, if I could squeeze as hard as I can, if that was a 10, I'm probably squeezing it about a 6 or a 5, but I'm also shaking and I'm watching that. I want to get about a third of that carpule in there. And then we're going to massage it in just a little bit. And typically I'll talk to Brad and talk to him what's going on with the Longhorns, with the Cowboys, and we'll jump up to 11 and do the same thing. I'm going to do a third of a carpule on 12 and 13, a third of a carpule on 11, and a third of a carpule on 9 and 10. And trying to distract him, trying to get him to think about what's going on in the world. We might talk politics, might talk football, and I'm just kind of constantly working that in. And this one's obviously a little trickier here, a lot of little nerve endings up in here, but if we set it right there, and again, just pull that tissue over there. I'm never moving that needle or the syringe. I just want it to kind of do its magic. And Brad, if we played our cards right, we just did your first round of anesthesia without you feeling anything, hopefully. And then we're going to let that, that's just one carpule that covered 5 teeth. And we're going to let that soak in just for a few minutes. I'm going to massage it in there. How we do, brother?
I didn't do a thing.
Awesome. Awesome, awesome. Then while that warm Sitinist is setting in there, we're going to do the same thing on the right side. And just like we did on this side, we're going to split 4 and 5 and start that. So I'm going to just go right in between those two guys and start shaking a little bit. And again, I'm not going to move that needle. I'm just going to pull that tissue over as I'm shaking. And same thing, we're going to do a third of carpule between 4 and 5, third of carpule on 6, and a third of a carpule on 7 and 8. The reason I do the cuspid by itself is because it's a lot longer tooth, and that root apex is a lot way up there. But I'm going to, again, I set that needle and I'm just going to pull it over there without moving it, shaking at about a 6 pressure. Just enough where he's wondering what's going on, but not enough to hurt him. Brad, you're doing great, brother. Awesome. This whole upper lip's going to be pretty thick here in just a minute. These are the tough ones right here. You're doing awesome. So we've got our first round of anesthetic in there. Then we're going to switch to a buffered septicane. We use Onset by On Pharma. Is that right? Set that in there, set that in there. Put it on 9 as our setting. We're going to do the exact same thing on the left side. He's frozen here. I could probably just be aggressive and do it, but I don't, just to be on the safe side. So we do the exact same steps we just did, but with now buffered articaine. And we're going to split 12 and 13. Not moving that needle, just moving this tissue only. I got this technique from, I raise Texas Longhorn cattle, and I had a vet come out, and these Longhorns have really long horns, and they're hard to, you got to keep away from them, they'll poke you. He said, you got to be real careful with these Longhorns. He said, so what we're going to do is we're going to grab a big hunk of the skin, and when we had to give them their vaccinations, we would, and it was a big needle, but you grab a big hunk of skin and do the exact same thing. You just pull it over the needle. And so I got this idea. I said, you know, I bet we can do this in dentistry. And it turns out you can. We're only going to use 1 carpule of Citinus on the left side, 1 carpule of Citinus on the right, and then same thing, 1 carpule of Septicane on the left and 1 carpule on the right. Brad, you doing okay down there, brother?
Yeah.
No pain whatsoever?
None.
Okay. I like to go once I'm finished with anesthetic, just kind of massage it in, just kind of move that tissue, move that anesthetic around, and it kind of feels good. It just, there we go. Okay. And we're going to do the same thing on the upper right. The good thing about this technique is as soon as I'm done here on the upper right, we'll be ready to start on the upper left. It works really fast. I'll try to show you how to do that. See how we pull that tissue over. Don't move the needle. And voila, we will have a very, very numb patient. Now, Brad, your job too is to let me know if this starts to wake up. This should keep you numb a couple hours, but everybody's different. Some people you start waking up in about 45 minutes, and some people it's 6 hours. So there's no right or wrong answer. It's just when it starts to wake up, you let us know, okay, buddy?
All right.
Same thing on 6. I'm going a little bit farther up just because that's a longer tooth. Kind of remembering my anatomy, this angling it back just a little bit on this. Okay, and then the last one, we're going to do 7 and 8. Set it right there, pull it over. Very, very good.